Picture this. You're an athlete and you're playing the sport that you love, running around without a care in the world. All of a sudden you go to take a step and then it happens. You fall to the ground as you hear a loud popping noise and you're clutching your knee in pain. What just happened, you ask? You've just torn your ACL. The anterior cruciate ligament, more commonly known as the ACL, is what I'm going to be informing you on today. An injury to the ACL is a very common yet potentially devastating injury that can affect all people, especially athletes. I feel as though I'm qualified to talk about this topic as I've done extensive research. Also, if you don't know already, this exact scenario I just asked you to picture is what happened to me just short of a month ago. I've had first-hand experience and I'm currently going through this process. So hurting the ACL, as I stated before, is very common, but I feel like the details of the injury aren't really well known. So today, my goal here is to explain what the ACL is and its function. Second, types of injuries to the ACL as well as the surgeries provided. And then lastly, the rehabilitation after surgery. So now we're just going to start with some basic facts about the ACL. The ACL is one of the four main ligaments that helps hold the bones together and maintains the stability of the knee. According to the American Academy of Orthopedic Surgeons, the specific ligament controls the back and forth motion. As for the location, it runs diagonally in the middle of the knee, which connects the tibia to the femur. It also sits right behind the kneecap. This ligament aids in the rotational movement of the knee and helps the knee from essentially giving out. It is very important for athletic movements, according to Joe Giandonato, a manager of health performance who is a contributing expert for Stack.com. So there's three main types of injuries to the ACL, which I will now briefly talk about. Dr. James H. Lebowitz, medical doctor of New Mexico knee surgery, has stated the main differences between the three types. Grade 1 injury is a mild sprain. Nothing is torn, nothing is damaged, the ACL is just a little stressed out. A grade 2 injury refers to a partially torn ACL, where it's torn but not all the way. This is very rare. Lastly, a grade 3 injury is a completely torn ACL. This is also known as an ACL rupture, and it's accompanied by immense swelling and pain. However, the pain varies from person to person. An ACL tear is an injury that many people are at risk for facing. However, research and studies have shown that females have a higher risk. Beaumont Health System has stated that females are 5 times more likely to injure their ACLs than men. Besides gender, the sport that's being played is a determining factor as well. The most common injuries in the sports are football, soccer, lacrosse, and tennis. So surgery is highly recommended after you tear your ACL, but some people don't get the surgery. They live with their whole lives without an ACL. Some people can even go hiking or running without no pain at all. But many athletes that do tear their ACLs often get surgery within a couple months of the occurrence of the injury. The repair of the ACL is actually a relatively easy and successful procedure. So there's 3 different ways that an ACL can be repaired. One way is taking an ACL from a human cadaver. This isn't really recommended for young athletes, however. Another method is taking a graft from the patient's own hamstring. The hamstring muscle is large enough where it doesn't really notice a chunk of it missing. However, some athletes do complain about weakness. The last method that they can do is taking the middle portion from the patellar tendon. The patellar tendon helps connect the kneecap to the tibia, and then they take the middle portion out of that and make it into the new ACL. All these ways of reconstruction are very good and they're effective, but in different ways. For example, if you're older and you're not playing sports anymore, the cadaver graft might be the way to go. If you're an athlete like me, I just got the patellar tendon graft. So now we're just going to be talking a little bit about the rehabilitation and recovery after the ACL surgery. So rehab starts the day of surgery. Right when you wake up, you're placed in a knee brace that starts from your hip and goes all the way to your ankle. There are locks on each side which help control how much and how far you're able to bend your knee. Your doctor and your physical therapist that day will give you a list of exercises and other tasks to do. They mostly consist of bending your knee, strengthening your knee as far as you can, just doing range of motion type exercises, just to help keep getting the blood flowing in your legs. The first 2 weeks is mainly just strengthening the quad muscles, trying to get that range of motion. After the first 2 weeks is when you can start to put some weight on it, and the physical therapy will increase in intensity. From here on out is the most crucial part of rehabilitation in order to return to normal physical activity. After about 7 months is when you can start training and preparing to get back to gameplay. You'll be given a program, and it's a progression that you'll work through, and that'll help get you back stronger and better than ever. This includes jogging, sprinting, even playing in some drills. After you're cleared from this progression is when you can finally return to playing sports. So instead of having to go through all this trouble and painful process of going through the surgery and everything, I'm just going to give you some tips and preventative measures you can take to help make an ACL tear less likely. So first, always make sure that you get a proper warm-up and stretching. This helps get your body warm and can also help prevent other injuries as well. Strengthen your knee as much as possible, such as doing exercises like squats and lunges. This will help build the muscles around your knee, as well as getting those tendons and ligaments used to those athletic movements. Also, working on balance is another way to help in the prevention of ACL injuries. So today, you've learned about what the ACL is and what its function is. You've also learned about the different types of ACL injuries, as well as the surgeries that are provided. And then lastly, you heard about the rehab and some preventative measures about ACL injuries. If you've gone through this or any other injury, you know just how frustrating it might be. There is a saying, however, the comeback is stronger than the setback. It might not be the story that you wanted, but you can rewrite it and make it even better with hard work and determination. Nevertheless, I hope you found some of this information, as well as my personal experience useful. Thank you.